We cannot surge the capacity to meet the need if we don't bend the curve. We cannot. There is no reason why the things that you see coming out of Italy wouldn't happen here in Louisiana if people don't engage seriously in these mitigation measures.
Louisiana Governor John Bel Edwards on the critical need to obey orders to stay indoors. This as my hometown, the city of New Orleans, now launching a week-long personal protective equipment drive for first responders. Let's bring in the mayor now of New Orleans, Mayor LaToya Cantrell. Mayor, I really appreciate your being here because what's happening there in NOLA, we want to get the word out. So thank you.
Thank you. Thank you for having me.
Absolutely. And I want to start, if you could tell us why the need to start this drive for personal protective equipment for first responders. And in addition to the PPE drive, tell us how else you're fighting coronavirus. You know, if you could give us an idea of the overall picture in NOLA so we can understand how critical circumstances are there.
Sure. So as it relates to the PPE, it's been a need for the city of New Orleans, literally for the state, since our first case of March 9th. Our first responders, our medical professional personnel, even as relates to our mortuaries, our coroner's offices, our funeral homes, we're all in need. They're all in need of PPE, and that continues to grow as our cases continue to grow. Today we're at 1298. With, our death toll is around 90. So we're seeing the impacts here on the ground. And also as it relates to our surge capacity, wanting to make sure that we are truly meeting that need as our hospitals are on the verge of being oversaturated. We have identified the date of April 7th, where we would truly have reached our capacity, and therefore standing up our surge is something that we have been working on and doing at this moment, making sure that we're preparing for an upward of 3,000 of our patients to move them out of the hospital, making way for others who need emergency care.
Mm-hmm. And Mayor, in addition to personal protective equipment, what more do you need? I mean, we want to know what you need to help your medical workers. And are you in touch, by the way, with anyone from the President's coronavirus task force?
Well, we are in direct communication with our state officials and members that are served by the federal government. But on the ground in the city of New Orleans, it's really being stood up by local leadership, even by state leadership, that of our Louisiana National Guard even. So we do have boots on the ground. But when you talk about the needs of the city of New Orleans, of our region and of the state, it continues to be around the federal assistance that we have been advocating for. And even as we've seen measures passed at the federal level as relates to the CARE Act, we want to know desperately how that will be fully implemented so that we can get the resources again to the people who need them the most on the ground. We have seen a tremendous amount of our workforce be laid off. You know that we are a destination city, a world-class city. Yes. Hospitality fuels our economy. Over 110,000 workers are cultural bearers that are closely tied to our industry, that are in need of the resources right now to maintain just a quality of life, having food on the table. Child nutrition is something that we're focusing on, heavily advocating for USDA waivers that I understand are being granted. This is huge as it relates to the thousands that are dependent upon on our food service providers, Second Harvest Food Bank, for example, and many others that are here on the ground. So we appreciate the access, but we really want the results and the resources to hit the ground.
Absolutely. And Mayor, the U.S. Surgeon General, Dr. Jerome Adams, is saying that the worst is likely yet to come, that New Orleans is on pace for a New York-type week next week. After seeing infection rates climb in the last several days. And, you mentioned earlier, and I got it on my NOLA Ready text message, that there are happening at 12:38 p.m. Central Time, 1,298 confirmed cases of COVID in New Orleans, with 70 to 90 people having succumbed to the virus. So, and as I hear you, I know your fight. I've been keeping up with the news there closely because I'm from there, my family's there, and I know how hard you're working. But according to what I'm hearing from you now, Mayor, and I know that New Orleans is not the only city in need, but according to what the U.S. Surgeon General just said, New Orleans is really in critical need next. So we need to make sure that we put you and Governor Edwards, Bell Edwards, in direct contact with the people in Washington. I think that's what you need next, right?
Absolutely, and we appreciate that. And I'm telling you, the governor and I did not even wait to hear that was coming from the federal government, meaning the Surgeon General. We have been working on and standing up surge capacity for weeks now. So what it does say is that we're aligned with what the research and the scientists are telling us, and we are responding with real action on the ground. And we will continue to advocate for the needs of Orleans Parish, for our region, for the state of Louisiana.
Yeah, indeed. And, you know, I want to address something really quickly because I've seen it in the news. Okay. And, you know, look, February 25th was Mardi Gras. February 28th, our president, who has since, you know, come up with some creative ways and great efforts to assist in the fight against COVID-19. But on February 28th, 3 days after Mardi Gras, the president was saying that this was, you know, the Democrats were politicizing the coronavirus. So I'm not asking you to speak against the president because I'm not speaking against the president as well. But what I'm saying, though, to that point, at that point when Mardi Gras happened on February 25th, not even the White House realized how grave this was going to become. And so I ask you, had you known then what you know now, would you have canceled Mardi Gras?
Well, I mean, in hindsight, right, it's 2020, and I'm hoping that the federal government would have provided even more leadership based on the science and the data that was being communicated. One thing also, Arnell, that we have to stay focused on Lundi Gras, February 24th, we were hearing from the federal government that the virus was contained. And so at the end of the day, this is about how we've been impacted, what are the results, and what are the needs that we need right now to ensure that we flatten that curve, that we prevent the spread, that we ensure that our people who are being greatly impacted by this, our needs are met on the ground with the resources that we've been advocating for. And so we can't continue to look back. We have to look forward, and that forward, what it looks like to me, is getting the PPE on the ground, getting the necessary resources and dollars on the ground to meet the needs of our people, getting the ventilators in the hospitals. That's what we need right now. And so I will continue to advocate and stand by the people of the state of Louisiana, the city of New Orleans, all of our parishes. And you know what? We thank you for the outreach, and we really do need the support and that of the federal government.
Mayor, I hear your compassion. Not only is New Orleans special to you, to me, it's my hometown, as I said, but the president and people around the world love New Orleans, and I'm sure that President Trump heard you, and we hope that help is on the way and very soon. Thank you very much, Mayor LaToya Cantrell.
Thank you so much. Thank you.
Absolutely.
We appreciate it.